Okay.
Welcome back. Welcome back to Living in Mexico. I'm Ana Maria Salazar. Thank you so much for joining us. I want to thank all of you who've been joining us throughout the years. It's an honor to share with you information, news, analysis about what's going on in Mexico, both in English and in Spanish. Well, you know, it's making headlines around the world, and we're all trying to understand the implications of these headlines, but the World Health Organization declares Mpox virus a public health emergency of international concern. For those of you who don't know what Mpox is, we're talking about monkeypox, but for different reasons, it's no longer called Mpox. It's monkeypox. It's called Mpox. Has to do with the stigmatization and other issues, but Mpox it is, and now it is, according to the World Health Association or organization, an emergency of international concern. I appreciate once again today's guest joining us this morning. You know him well, Dr. Mauricio Rodriguez. He was a spokesperson for through the entire COVID crisis, COVID-19 crisis. He was spokesperson for the UNAM. He is a teacher. He's a professor at UNAM Medical School, and he's joining us again today. Mpox, emergency of international concern. How concerned should we be here in Mexico? Welcome to the show.
Hi, Ana Maria. Thank you for inviting me again. It's always a pleasure, and we say hello to the audience. Well, let's just quickly remind of what a public health emergency of international concern it is, and in order to have one of these declarations, the problem must be an extraordinary event. It has to be a risk of international dissemination of the pathogen, and it requires international collaboration. That's how they configure the declaration of the public health emergency of international concern, because they need an international response.
Mm-hmm.
And what we are seeing in this declaration, because don't forget that in June in 2022, there was a previous declaration of emergency regarding Mpox.
Right.
That ended in April 2023.
Mm-hmm.
And what they are seeing now is that there is a new variant of the virus, and there is a dissemination of this new virus in several countries around the Democratic Republic of Congo. And that's why they say, okay, we have a new virus, we have international implications, and we need an international response. And that's why. In America, we don't have that new virus. We're still having the old virus. The technical name is clade 2B. And this new virus is the clade 1. And we are just expecting, and we must keep looking for the new virus in America. But the situation is mostly located in Africa, and that's why they say, okay, this is an international emergency of public concern. Yeah.
But why? When they say that, it sounds like they expect that it's there's some expectations that it's more dangerous, more contagious.
Yeah.
I mean, why make this declaration?
Okay, well, here are two reasons. One is that they are seeing that this new virus has slightly different characteristics comparing with the previous one. They say it's more contagious, and it could be a more severe disease, and that could complicate the situation. But the other reason is some sort of an administrative reason, because when they say that it is already a public health emergency of international concern, I mean, there's an official declaration of the emergency, they can use some resources that otherwise they can't, and now they can use those resources to put in place elements for the response. So they can put a lot of money. Now they can use a lot of money that it's waiting for these kind of declarations, and they can coordinate a better response. Actually, in the previous day, I mean, in the declaration of WHO was on the 14th of August, on Wednesday.
Right.
But the previous Tuesday, the declaration was done in Africa. I mean, the authority, the health authority in Africa, they say we have a situation, and they declare the emergency in locally, and the day after, the WHO was doing.
So, what should the Mexican government be doing right now? And I ask you this is because the expectation is, if you have this declaration, that governments are starting to take steps to start looking for it, identifying it, checking people who are coming from different parts of the world. How do we know it's not in Mexico already?
Yeah. Well, in Mexico, we have a system for the surveillance of Mpox since 2022. O sea, we are still having patients. In this year, there have been 49 patients with Mpox of the previous virus. In Mexico,
The
there
less
is
deadly virus, yeah.
And there is a infrastructure for the diagnosis. There is a protocol for the management of the patients. There are sites highly specialized in taking care of these patients. And in the same day than WHO make the declaration, the Mexican government give an epidemiological advice, an alert, saying the same. I mean, that this is a situation ongoing. It is happening in Africa. There's low risk in America, but still we still vigilant, and we're still keeping an eye on the problem. And it's just a matter of days that they will identify the virus here, and there is a protocol to define the cases, study the cases, to make the diagnosis, and to give treatment. There is no, tell me.
I guess the question is, and I guess what everybody's so worried about is it much more contagious? How contagious is it? How deadly is it?
The new variant. Well, there is not much information about that. Actually, they start to publishing some information of this. Could be more transmissible, more contagious than the previous, but also, I mean, that it was evaluated during a period without the restrictions and without the specific awareness regarding Mpox. Could be that is some kind of bias in that information, because it was evaluated in a different scenario. So in the same context than the actual virus, there's no enough information. We have to keep looking for more information. The problem is just located in 4 countries around the Democratic Republic of Congo. So it is, I mean, there's no too much information, but in the case that it is more contagious, also we have to promote all the general measures to avoid these kind of infections.
Okay. Well, the next time you come on the show, we could stop, because the point of talking about this is not to scare everybody or our listeners, but it's important to know and understand health concerns around the world.
Especially, and it is not a general risk. The risk is mostly located in people that is traveling to these countries and coming there, and people having a close contact with people with the disease, and The main situation of this is that the transmission of this virus was mostly among the gay community, men who have sex with men, and there is the risk. I mean, most of the cases are located in this community, so we have to focus the prevention and the information in this community, and of course to say with all the community the general information, just to be aware of what is happening.
And how is it transmitted? By air,
by contact,
droplets? By contact.
by contact with the lesions. I mean, with the skin. There's lesions in the skin which are very apparent, very visible, and some previous day to those manifestations, there's a general manifestation, fever,
Malaise.
fatigue, headache, and also with the respiratory secretions in those days, but mostly by close contact of the skin. That is the main risk.
Okay. Well, it's always great to talk to you, Dr. Mauricio Rodriguez, former spokesperson for UNAM on the COVID-19 crisis, and now he teaches at UNAM Medical School. Now, I'm sorry, I'm saying I do have one more question in terms of COVID-19. I know UNAM has issued recently a new press release. Let's just talk about that before you go. What
it's good to mention, Ana Maria, because we are having a very high activity of COVID. We are seeing mostly ambulatory cases, not complicated, few hospitalizations, very few deaths. But anyway, we are seeing a lot of patients with COVID, mild COVID in the community. So there is a sustained transmission since 5-6 weeks ago. We are perhaps in the peak of this summer wave. It is always in other countries, this summer wave. I mean, it's not only for Mexico. It's related to the introduction of a new subvariant of the virus and the holidays and changing the patterns of social activities. And you already know, if you have symptoms, you must wear a face mask, try to look for diagnosis, avoid gather with other people, try the basics of ventilation, hygiene, and try not to use antibiotics. We don't need a new round of vaccination at this point. We should wait for the end of the year, and just to be aware of the circulation of the virus in the community, which is the people with symptoms. I mean, if you have symptoms of a respiratory disease, use a face mask. If you don't want to go for a test, or you can't, I mean, it doesn't matter. Wear a face mask if you are with other people.
What's your experience with testing? Because there seems to be a sense out there that the testing that is taking place, everybody is not necessarily that useful, because the testing seems to be, and that's been my experience, just basically kind of highlighting that you're negative. I mean, do we know, has there been any change?
Yeah, well, the window to detect the virus in the rapid antigen tests, it's very wide. I mean, you have to be between the second and no more than the fourth day of the symptoms. It must be very apparent symptoms. But anyway, it could be very useful if you can do a test, at least to discard the situation. Because if it is not COVID, perhaps it's influenza and you can receive oseltamivir. But also in terms of contagiousness to the community. I mean, if you already know that it is not COVID, okay, you can do your activities with a little more confident behavior. So we cannot count any case. I mean, that's why it is not counted any case in the community. That's
Right.
why the Sentinel surveillance system is for. I mean,
Yeah, but there is a sense that with everybody coming back from vacations, from traveling, the start
all
of
of them
the
are.
initiation, the initiation of fall, change in weather, and of course everybody's going back to school, and that's where kids get sick. They're like, it's like a petri dish, everybody, everybody gets sick in a classroom. I mean, are we at the peak right now, or does the peak come sometime in
Perhaps, yeah. Well,
September?
perhaps we were at the peak 1 or 2 weeks ago. We will not
Hmm.
see until perhaps 2 or 3 more weeks.
Yeah.
But in the schools, it's different because the people that is sick in the school,
Hmm.
they take care. I mean, they don't go to classes.
Right.
In the school, some of the schools they say, okay, if you have symptoms, that actually in UNAM, that's what we say. Okay, if you have symptoms,
Hmm.
wear a face mask and
Hmm.
try to avoid your activities
Hmm.
unless you feel well. So let's hope that the
Yeah.
wave goes down in
Hmm.
the classes, and we have some good indicators in Spain and in some cities in the United States, which they are already going down in the wave.
Hmm.
So it's just a
That's
matter
the
of
hope.
day.
Yeah.
But anyway, we have to keep protecting the most vulnerable people in the community, because
Yeah.
in that person. And don't forget, COVID, even if it is mild, it ausentism, use of antibiotics, spending on healthcare. Uh, I mean, there's a lot of healthcare need in the community,
Hmm.
and I mean, there are several problems related to the mild cases. I mean,
Right.
don't be expecting the hospitalizations and the deaths. We can
Hmm.
recognize the impact in the society.
Yeah. Yeah. And then, of course, which is a conversation for another time, there's always the post-COVID or long-term COVID that we have to
Exactly.
always
That's another
have to be
point.
thinking
I
about
mean,
it. Yeah.
all the
Yeah.
people that is I mean, all the damage related to COVID,
Hmm.
descompensation, diabetes,
Right.
descompensated, stroke, heart attacks, hypertensive crisis, renal failure. I mean, there are a lot of acute problems during the COVID, and
Right.
we have a lot of post-COVID condition. So if we can avoid that, please wear a mask if you have symptoms, and try to avoid transmitting the virus to other people.
Yeah.
That's the only way.
Well, it's always good to talk to you, Dr. Mauricio Rodriguez. Uh, he's a professor at UNAM, at the medical school at UNAM, and he former spokesperson for the COVID-19 for also for the